The story I have to tell is sad. I get sad just thinking about it, and I don't want to make you sad, but let's be honest. Storytelling is selfish. It's for the writer, not the listener. It's to help me channel this sadness so that you can maybe take some part of it. But I'm trying not to be a selfish person. So how about this? When I get to a sad part, I'm going to throw in a fun little thing that happened during third year so far. You know, like a little pick-me-up. So we all don't get too emotional, okay? I met Elliot Saber in the hallway of the hospital because that's where his bed was. I hadn't been assigned to his case yet, but I already knew his story from rounds and how bad it was from the way the attending would always say, "What a sad case." Elliot was in his 20s. He was my age, our age, and he had been feeling very tired recently. He had lost weight, started having very bad abdominal pain, and had this annoying cough that just wouldn't go away. But the real reason that he was there was because he and his equally young wife had been trying to conceive for a while. And when he went in for a fertility workup, they found a mass in his kidney. Okay. All right. So, ready to hear a classic third-year blunder story? I was talking to a patient who had a laundry list of chronic illnesses, one of which was diabetes. And due to his diabetes, he had gotten both his legs amputated. So, he and I were having a pleasant conversation. I'm hitting every item on the checklist. I mean, I'm going through all his meds, his vaccinations, and of course, I make sure to ask him, "So, sir, when is your next foot exam appointment?" So, Elliot and his wife were laying in bed. I told you. So, Elliot and his wife were laying in the bed together, and his hand was on her stomach because, surprise, she had actually gotten pregnant since his mass was discovered. He was rubbing her belly with his hand as we talked, even though he could barely keep his eyes open. He looked bad. Like, you could count every rib bad. The attending walked in, introduced herself and the team, gave a brief one-statement summary of the plan, and then we all left. I officially started following Elliot as a patient 2 days later. By then, he had gotten full body scans and a kidney biopsy. I made sure to introduce myself the ASM way, told them that I would see them every morning and at least once during the day, and I made sure to ask if they had any questions. The first meeting is always the easiest because I know literally nothing. The test results are still pending, and all I can say is, we don't know yet. All we can do now is wait. It gets harder once you start to know things. Like when the scans come back and show some things that look like metastases to the lungs. Or when the biopsy comes back to show an incredibly rare, extremely aggressive renal cancer that there are barely any case reports on because it's barely ever seen. Then you go into the room and you know it's bad, but you don't know what they know, who's talked to them already, how they're feeling about it. And who are you? Just a third year that told them you would be taking care of them. So they look to you for answers because you're the only person that they see for more than 60 seconds per day. But you don't want to step on your team's toes. You don't want to step on other teams' toes. You know how you would handle the situation if you were in charge. But you're not in charge. You just float around hoping to learn something, hoping to not make an ass out of yourself. Every day, I went in there hoping that somebody from urology or someone from oncology had spoken to them already about what was going on. But no one had said anything. And with his hand on her belly, they told me that they felt like everyone was tiptoeing around them, that it wasn't fair because she was pregnant and they needed to plan for the future. I couldn't have agreed more. So I was in an outpatient clinic and I was interviewing this 71-year-old woman who was described as eccentric in the notes. Oh, you know where this is going. So, this encounter stuck with me for two reasons. Number one, at some point, we were discussing her spirituality. And she told me that she could feel spirits and demons moving through her, but that Jesus always protected her. And he would occasionally move through her too. That's just number one. Number two, as I was doing her physical exam, I noticed that she had the most perfect breasts that I had ever seen in real life, let alone on a 71-year-old woman. I mean, I'm no expert, but let me tell you, if I had had those breasts when I was going through puberty, they were incredible. And I know, my body will never achieve anywhere close to that level of perfection, but honey, they gave me such hope for my future geriatric physique. I argued with the team about the plan for Elliot. I mean, how could we not tell them that we know what cancer it is? We've been sitting on this information for 2 days already. What? So we're just supposed to wait for some other team to break the news to them like it wasn't our responsibility? Their answer to me was that we didn't know the exact prognosis or the probable treatment, so we shouldn't say anything until we can offer something to be done. I wholly disagree with this notion. I mean, who knows? When I get to the level of an intern or a resident, maybe I'll change my mind. But I just can't imagine how frustrating it must be to have to sit in that hospital bed feeling like shit, day after day after day, and have no answers and feel like no one is telling you anything and that nothing is being done. His wife would say things to me like, "We can't wait for him to get well enough to come home." Or, "It'll be great when he gets his strength back." But by the third day, she started to say things like, "Will he always be weak like this?" and what the hell am I supposed to say to that? Yes, he will be weak forever. That is, until he dies in a few weeks. course I didn't say that. I just did what everyone else did and sidestepped the issue. Finally, the intern told them the seriousness of the situation over the weekend while I wasn't there. The urologist also came to talk to them and said that the plan was to remove the malignant kidney as soon as possible and then potentially start chemo. Their impression on Monday morning: kidney will be removed in a very simple, very quick procedure, and prognosis is great. I wanted to turn around and yell, "Who the fuck told them that?" But no one else was in the room but me. So I stood there awkwardly, sweating, as the wife explained to me that she had looked up the kind of cancer and saw that the prognosis was very good. Of course, there had been some kind of miscommunication, and she had looked up a completely different kind of cancer with a different prognosis. Her only question to me was, what about the cough? Well, apparently, the urologist had failed to address the small masses in his lungs that were most likely metastases from his incredibly rare, extremely aggressive cancer. In complete shock, I asked them, "Has no one talked to you about his scans or what's been going on in his lungs?" And they both said to me, "No." As gently as I could, I explained that we didn't know yet exactly what was going on in his lungs, but it could be pneumonia, but because he didn't have a fever or any other signs of pneumonia, they were most likely metastases. Shocked silence. I could feel my heart pounding through my ears. Maybe I shouldn't have done that. I felt cornered and frustrated, and I wanted to be as open as possible, but maybe I just wasn't equipped to handle the consequences. Wasn't equipped to handle the natural follow-up question, which was, "So what are you going to do about it?" My meek response was that I had to check with the team what the plan was, because I truly didn't know. I said something stupid like, "You guys have had a lot to take in the past few days. I can leave you alone to talk about it." What an idiotic thing to say. Speaking of idiotic things, so I was giving a patient presentation to a preceptor who clearly was not a fan of me to begin with. And for the cardiac exam, I said, Normal S1, S2, no murmurs, rubs, or gallops, but the PMI was not heard. She gave me a little pity smile, and she said, "The PMI is felt, not listened to." I am excitedly awaiting my evaluation from her. Things rushed downhill from there. All the teams switched that weekend, so of course the whole plan changed. I came in the next morning to report that he was not actually going to be getting surgery as soon as possible because the benefits of putting him through a surgery were questionable if he had metastases in the lungs. So instead, we were going to be doing a bronchoscopy first. His wife said to me, "You've got to be kidding me." And Elliot, he just turned on his side in his bed with his back to me. I left for Thanksgiving break that day, and I cried on the train home. Of course, his bronch results came back positive for cancer, and by that weekend, they had it. They wanted to leave the hospital. I wasn't there to hear the conversation, but apparently the team hesitantly okayed it because he was gonna die. And who wants to die in a hospital? The only problem was oxygen equipment apparently can't be given out on the weekends. I mean, who knew? But Elliot and his wife were determined to leave. So they left on a Sunday. And on Monday, they were back in the emergency department because, shocker, he couldn't breathe without a nasal cannula. I saw them in the emergency department while I was checking on some other patients and said hello. They would barely look at me, but I'll give the wife some credit. She angrily told me about the whole oxygen situation. And then eventually, she gave me a small smile and said that it wasn't my fault. I wouldn't have been able to do anything about it. Elliot wouldn't even make eye contact with me. Once I told a woman that she had Graves' disease, and she said to me, "What an unfortunate name for a disease." And that had truly never occurred to me. Elliot has been bouncing around intensive care units. He's been intubated, he's been extubated, on chemo, off chemo. He's had 7 to 10 different specialties looking after him. And he's probably met hundreds of people since he was hospitalized. I've thought a lot about it, but in the end, I decided that visiting him and his wife would be selfish of me. It would be more for my benefit, my peace of mind, than theirs. And you know, I'm trying not to be a selfish person. Well, aside from sharing this story,
We will now have a 10-minute intermission.